All right, guys, welcome to episode 29 of the Well Balanced series, which is crazy because I feel like I did episode 1 yesterday. But I'm so thankful for today's guest, who is Jen Merrick, and she is an expert in the thyroid, which I think is a conversation that is it's a very complicated conversation, but definitely one that everyone should learn more about. So I'm super excited to welcome her and get this party started. Let's see.
Hi,
Hello, Jen. How are you?
I'm good. Can you hear me okay?
I can hear you. Yes. Can you? Sometimes the Wi-Fi is tricky on these.
I can hear you.
Okay, I can hear you.
You can?
Yeah.
Okay. Let me know if I echo too much because, we just moved. And so we don't have anything on the walls.
No, you're good. It's
So,
definitely, you're in like I can tell a little bit, but it's not bad.
okay. And I can always actually walk outside too if it's a little bit too much. So
No, you are totally fine. Congrats on the move, by the way. That's exciting.
thank you. It's been crazy, but it's good. It's all good stuff, but it's a lot, a lot, a lot,
Yes,
a lot, a lot.
yes, I'm
So
sure. It's a beautiful home, and welcome to the East Coast.
thank you. I'm originally actually from New York. So um, being back kind of in the East Coast from when I was a kid is kind of nice.
Yeah,
So
no, it is.
it's
That's
kind of
awesome.
it's comforting to me, and it's nice. So it's just a huge change from Chicago, but all good things.
Good. Yes, no more crazy snow as much, at least.
No, not at all. Not
Well,
at all.
I am so thankful for you to join today and be
Yeah,
here.
thanks for having me.
I think this conversation is one that many people get confused about. So I'm excited to kind of clarify some things as we go. Um, so I have the questions pulled up that I just sent to you that were sent in. So we'll go
Perfect.
over those. I'll kind of guide those as we go. And then I always love starting out with a little bit of an introduction. So just a little bit more about you, what got you into
Yeah,
this space, your journey personally, I think is always really interesting. So we'll start there.
totally. Yeah. So, and I think the biggest thing with the thyroid is it is very complex, and it doesn't have to be. I think for myself, I was so overwhelmed by it, so I kind of would ignore it. And since working with clients, I've realized that everyone struggles in some way, shape, or form, at least my clients, with it. And so I had to become very comfortable with tackling it and understanding it from just an easy, digestible way.
Mm-hmm.
So my background is actually in medical aesthetics. So I spent the last 15 years as a paramedical esthetician, working in more of the medical field. So dermatology was pretty much my biggest thing in the last 15 years. And I have 3 kids. And so my middle son is 6. And once I had him, my kind of health pretty much tanked overall. I will say I spent most of my life never feeling good, chasing kind of what it was, trying to understand it, struggling with weight, doing every diet imaginable. And, once I had him, it was kind of like everything just kind of broke down. And I was very into nutrition. I was very into learning different types of things of how to support the body. But everything I was doing, I was always missing the mark. I was very much chasing weight as that marker of health versus everything else that I focus on more now. So once I had Henry, I kind of went, okay, where are we now? I started to get very scared in my health. I was dealing with, a lot of joint pain. I couldn't use my hands properly. It was just a lot of inflammation in the body that was scaring me. And I got scared for the first time that I put the scale away. I said, I'm going to focus really 150% on health and the rest will follow. And so at that time, I basically fired all my doctors because they were telling me the same thing for years. They weren't listening to me. They weren't running proper tests or any of that. I definitely went into more of the holistic functional route. And then as I started to heal with food and kind of peeled away that onion of my health journey, I decided to go back to school. And I went, I enrolled in the NTA like you are as well, or did. And I graduated, I enrolled in 2018. And so I did the FNTP program.
Mm-hmm.
And then I graduated from the 2018-2019 class. And at the time, I was still working in dermatology. And so with my health struggles and then really working with my patients in the derm office, I was very busy there. I was seeing probably 140 patients a month.
Wow.
So mostly women, but I had some men and some teens sprinkled in there. And what I was starting to realize was everything on their skin, their acne, their dry skin, their eczema, their psoriasis, their hair loss, there was such a bigger issue that we were not getting to. And so during my, journey with the NTA and then working with them and with my own health, it was like light bulb moment. Everyone is struggling with digestive issues, thyroid dysfunction, mineral deficiencies, and all the things. So, it was really kind of that combination of why I decided to become a nutritional therapist was for myself, for my family, but also for a lot of my patients in the dermatology office, because I was watching these women struggle. And it was never just about their skin. They were struggling with anxiety, depression, stomach issues, just all these different things. So, back in 2020, when kind of the world kind of flipped upside down, I left the derm office 100%, and I focused instead of part-time on Gen Merrick Wellness, more full-time. And so back then in 2020, I enrolled in restorative wellness. I did 3 levels of that. So I've really spent the last 2 years working a lot with one-on-one, going back to school, understanding, more about minerals and thyroid function and gut function and kind of all the different things. So that's kind of where I am now. And so it kind of was just a little bit of everything that led me to where I am, ultimately now.
Yeah, no, that's an awesome story. I think that from having the esthetician side of this is very unique because, again, skin conditions, you automatically think, oh, I'm going to go to a dermatologist, but they never talk about what's going on internally. And even just learning about dry skin and like how healthy fats support that and all these other things, it's just crazy how connected. So I'm sure that was really eye-opening for you and unique.
For sure. And I think it's, when someone comes to me, because a lot of my clients do struggle with skin concerns, it's not fun, right? Well, everyone, right? I mean, and it's like, even, I think that we associate, skin issues with teenagers, but that's not the issue. I mean, I have clients in menopause who are struggling with skin concerns, and I did in the derm office too. But the problem is we're fixing it so much with the Band-Aid approach. And unfortunately, that Band-Aid approach is actually causing more harm than good, but it's on our face. We can't help but, be stressed out about it. And then the stress triggers the acne triggers the stress, and it's this ongoing cycle. And I always tell my clients when we're working together, like, you're not going to just have clear skin overnight. I mean, it takes time, and that's not the fun part, because you want that quick fix, because it's hard to do that. And it's kind of an emotional thing too. Like you've shared with your journey on kind of breakouts and stuff like that. It's frustrating.
Yeah, it's so complicated. And I think, and even just healing in general, it's not linear. There's going to be ups and downs. And I think learning that and being okay with that is something it's hard for people to accept coming from that kind of history.
It's very hard. Yes. Yes.
But yeah, I think that's really cool that you have all that knowledge, and you've been really diving deeper and helping so many women. I think it's amazing. So with regards to today's topic, which is the thyroid, we'll kind of dive into that since that's something you're passionate about. So again, first question was really just explaining what the thyroid does. So we'll kind of start there.
Yeah. So pretty much when we think of the thyroid, and I'll kind of go into the testing and kind of all that stuff, but basically what it is, it's part of the endocrine system. So when we're talking about hormones, when we're talking about stress, we have to remember that our thyroid basically sets the metabolic pace for the body. And so it doesn't do just one job. I think more in this realm of things, we hear more. I mean, its main focus is metabolism, right? So if you think about your body's thermostat, that's your thyroid. So basically everything we do, how we feel, how we breathe, how we move, how we think, literally everything. And so when we're healthy, every metabolic process can function within the body. So it's located in the neck, kind of if you think of where an Adam's apple would be underneath, and it's kind of this butterfly shape. And so we have, when we're looking at the thyroid, there's different ways to really hone in on it and to see what its function is. And a lot of times for myself personally, one of the biggest things to look at is symptoms. And then look at it from more of a mineral standpoint, so like an HTMA test, and then also blood work to really have a good understanding. But our thyroid has to be functioning properly from the start. And I would say 100% of my clients are not optimized with thyroid function, including myself. It's an ongoing process of it. And I think that the biggest thing of it is when we think about metabolism, we think about how big or how small you are. And it has nothing to do with that. Yes, it's going to, we're talking about energy and we're talking about our temperature and we're talking about all those things. But when we're really talking about our metabolic health, we have to remember that it is not just the way that we look. And unfortunately, we see it in this scope all over the place where people are talking about metabolism and how you can increase and how you can do all these things for your metabolism, but we're starving people more, we're making them work out more, we're doing things that are actually impacting our thyroid from more of a negative standpoint. And so I think that we're seeing more and more dysfunction in general. Does that make sense?
Yeah, no, for sure. I think I even got my HTMA back yesterday and I was like, oh, need some support there.
Everyone does. Everyone
Yeah.
does. Absolutely.
So I think that's kind of
And
crazy.
I think that so basically when our metabolism is working, so if it's playing a role in everything that we do, our thyroid's playing a role in everything that we do, our body's producing more or less heat depending on that metabolic reaction. So one huge symptom of maybe having a sluggish thyroid is being cold all the time, not having that warm body like we should, or having a really hard time warming up. And then opposite, sometimes people can't tolerate the heat. So there's more heat intolerance. So when you think about the thyroid, the biggest thing to really think about is metabolic function. But we also have to think about, it does interfere with our hair, our skin, our nails, our gut health, our liver function. If we have high cholesterol or our cholesterol markers aren't great, we need to look to the thyroid. Depression, anxiety, all of that is really a huge impact. And I think what happens so much is we just kind of put one thing in the corner and we forget that it is actually in control of so many different organisms within the body, and we kind of don't prioritize it enough.
No, I definitely agree. I think, and again, I think people don't even know where it is or what it does. And so it's definitely, just it's not confusing. Like you said,
It's just overwhelming.
Yeah, it's overwhelming and we just
Yeah.
don't know. And it's a lot of those foundational things that I think that will support it, but we just still don't even know where to go for that. So that makes sense.
And so really when you think about sluggish thyroid, you have to think about sluggish metabolism. And that's kind of really just, in general, and that when our metabolic health is not optimal, it's going to basically deplete the majority of other things within our body. So that's why we have these different markers of health that we should focus on versus what's your weight and what's your BMI. And that's it.
Right.
Which so many do, unfortunately.
Yeah. Oh, I've come from a training history background, and it is crazy how the weight is still, so prominent. And it's like, well, yeah, but are you having a period? Are you, losing your hair?
Yes.
What's going on? So totally get that. Okay. So habits that affect thyroid health and that also support it.
Yeah. So one of the biggest habits, I would say, and one of the biggest things to step one in general is going to be stress. So your adrenals and your thyroid go hand in hand. So you can't support one without supporting the other. Bottom line. So when we have hormonal dysfunction or imbalances, we tend to go straight to working on hormones, but we forget about the stress and we forget about the thyroid. So all part of the endocrine system, we have to really make sure that we're supporting both. I would say stress is probably one of the biggest things. And the reason why stress is so important is because when we think of stress, we think of, I moved to a different state, I'm sitting in traffic, I got a divorce, I quit my job, right? We think of like these big things in life, but we don't think of toxin exposure, environmental factors like mold or different things like that. We don't think about our beauty care products. If we're using Teflon pans, are we drinking tap water? So I would say the number one thing to work on is that stress bucket. And so, your stress bucket it's kind of like when someone says, well, I don't understand. I've always done this. Why is it now affecting me? It's like, well, your stress bucket is overflowing and we're constantly adding to it. And so we need to lower that stress bucket as much as possible. The biggest thing too with stress is stress impacts our minerals, and our minerals are the spark plugs, right? So our thermostat is not going to be working properly. Our house unit isn't going to be working properly if we are depleted from minerals. So when we think of stress, we have to think of medications. Are we drinking tap water? Are we eating enough? And are we eating balanced? Are we doing more of a keto lifestyle and taking out all carbs? Are we eating low fat? Are we not eating enough protein? So really working on stress and all of the different components is always going to be number one when it comes to thyroid function in general. I think that, and I did this for a very long time, is, we chase these symptoms with more supplements. Mm-hmm. And we don't realize that those more supplements can be adding more stress onto the body and impacting our thyroid even more. So that's the hard part, right? Because it's not just one thing or just do this or just do that. So if I had to pick one thing, it would be work on stress, schedule more time for fun, make sure that you are actually relaxing and, basically working on that vitality and your stress in general so that your thyroid can function optimally. Because if we kind of skip that and we just jump to the fun supplements or we jump to buying all the different products and all the different things, we're missing that key component to everything, really.
No, I think the stress is it's so crazy, but it's so hard to do it. It's everywhere, but it's such a common theme, and it's crazy how connected it is. And I think people don't realize, like you said, the internal stressors that we typically are around that are a huge, huge problem. So, okay, so this kind of goes with this question. We talked about some habits and you touched on foods, but are there any specific foods that really can support an underactive thyroid or eliminate?
Yeah. So when we think of foods in general, things to really focus on, because I think that's the biggest thing is, okay, what am I eating and how am I living that is possibly impacting my thyroid? So when we think about food and when we think about nourishing our body in general, it's hard because we forget, like, eating more food with a label will just support us as much as possible, right? Shopping that perimeter in the grocery store is always going to support our body as much as possible because we can recognize it. It's like, here's an orange, here's a steak, here's seafood. So when we think of, let's say, animal protein that's one huge thing to really focus on. And not just one type of animal protein, because we tend to do chicken or turkey as a society, and we tend to kind of forget, sorry, my kid just got home. We tend to forget kind of all the other things. So liver, so lamb, bison, beef, poultry, turkey, all of those different things. Also really incorporating shellfish and also seafood is huge for your thyroid. because it's packed with so many different minerals that we really, really need for our thyroid to thrive. So protein from that standpoint of a good variety. So I always tell clients, and just in general, if you are someone who eats a lot of chicken, because a lot of people do, just try to mix it up. You know, maybe add in cod once a week, add in shrimp once a week, try oysters here and there. You know, maybe add in lamb or bison instead of it only being just chicken and all poultry basically. A couple of other things that I really, you know, focus on is kind of bone broth, and, you know, because you're getting the minerals from that, which is huge. Pasture-raised eggs, you know, chicken, turkey are obviously big, like I said. Sea vegetables, so kelp or, kelp granules are really great because you're going to have more of that iodine in there. Well-cooked greens are great for like calcium and magnesium. If you can tolerate dairy, adding in raw dairy or even adding in things like ghee, butter, you know, not everyone can tolerate dairy, and I feel like dairy is some people are all for it and some people are not. I feel like it's very controversial and it shouldn't be, but I do think prioritizing quality over anything else is really, really important. And then really a lot of, you know, different fruits and vitamin C. So peppers and oranges, guava, I mean, lemons, limes, anything that you can recognize and your body can support, those are going to be mineral rich. And that's going to support your thyroid in general. And so I just think really sticking with the eating more food that doesn't come with the label is kind of the most important thing. Instead of getting too worked up into like, should I eat this? Should I not eat this? Should I do this? Should I not do that? When it comes to thyroid function, and like if we're looking at, we'll talk about testing, but like in HTMA, calcium and potassium kind of make up that thyroid ratio. So food that is really rich in potassium, so coconut water, you know, mineral rich different fruits are really great. Aloe is really great. And then you have calcium, which, you know, raw dairy, well-cooked greens, and so on. That can really be just helpful for function in general. When it comes to eliminating things, another controversial thing, you hear kind of mixed things, but usually gluten is one thing that I find doesn't support most of my clients at all. And I think that that's going to depend on where your journey is and what type of gluten that you're having. You know, some people do okay with sprouted, or they do really well with homemade sourdough. But I think that that depends on you, your journey, your background, your goals, your testing, and really where you are. But most of my clients eliminate gluten, support their body, work on healing, and then some can add in sourdough here and there. Some decide to keep it out long term and they feel their best that way. That would probably be one of my big ones. And then also like soy, processed foods and stuff like that.
Yeah, no, that makes sense. I think the gluten and dairy, it's a tough thing to convince people of, but it is
It's a big one.
Yeah, so nutritionally dense on the dairy side. Gluten for sure. I have had my struggles with that and realize I'm better without it. So
and everything's different. You know, I mean, some people thrive in one way and other people don't. It just really depends. And I think the biggest thing that we have to remember is extremes will wreck your thyroid. So if you're going to eliminate any food group in general, if you're going to be just strictly carnivore or you're going to be strictly vegan, it's an extreme. And your body doesn't do well with extremes. So I think eliminating those type of extremes as much as possible is always going to be your best bet, for sure.
Absolutely. No, it's all about balance, but also like, you know, you have to be realistic. And I think even in this like pro-metabolic type of more approach, people are still looking at things as good and bad, and they're all whole foods. And it's like, they're not bad. They're just not as supportive for you as they may be for someone else. So
yeah. 100%.
Okay, so you did talk a little bit about, you know, when your thyroid isn't functioning optimally, you're typically colder or you're more sensitive to heat. So can you touch on just like temperatures? There were some questions just about, you know, how the lower temperatures, if it's like one day, does that mean your thyroid's wrecked, or is it consistently, that kind of thing?
Yeah, so I mean, same thing with kind of the extremes. I think that, you know, when we're looking at our basal body temperature, I think a lot of times we think of temperature as just kind of working and optimizing just what is our fertility. And it's so much more than that. It's a really simple marker that anyone can do, very affordable. You know, it takes a couple of minutes in the morning or in general to make sure that your body temperatures are rising, especially as the day goes. So no, if you have one day of a low temperature, now I have clients who have been in the 95s and 96s, let's say. Ideally, we would be in the high 97s and kind of go up. So when we have a warm body and when we are, even our, like our pulse shouldn't be super, super low. So one thing that a lot of my clients will do is they'll just kind of track it over time and they'll just keep an eye on it and see where their temperature is. As you kind of peak towards ovulation, you're going to see a spike, and then we usually see more of a drop. But regardless, if we're looking at it just for thyroid, just making sure that your body is warm. Now, if you notice, okay, my temperatures are really low, they were they were great. They were high 97s, low 98s all last month, and now they're dropping a little bit. That's when I just say, okay, check in with yourself. What happened in the last couple of weeks? Are you eating enough? Are you balancing your blood sugar? Are you eating enough and are you eating balanced? What's your stress levels like? Have you been sick in the last couple of weeks? So I think it's really making that connection with your body instead of just, it's the same thing like a scale. It's like another number that we tend to restrict and over obsess about, you know? And I think that that can really make a huge difference. It makes a big difference in anything. And so, yeah, so I feel like just keeping an eye on it as much as possible. And if you think of your thyroid as kind of that internal thermostat, it makes sense to why we want it to be, you know, higher, and we don't want it to be, you know, in the 95s and the 96s like
Makes
that.
sense. Yeah. No, I think it's, again, it's one-off. It could be from alcohol. It could be from sleeping poorly. You know, there's so many reasons. So I think when people get so granular with the stuff that we can teach, you know, it's big picture what's going on. So,
and I also think too, it's like, okay, did you have alcohol the night before? Were you under the weather? Were you sleeping with a heated blanket? I mean, there's so many different things that can impact it. And then I've had clients who have kind of spinned out of control over that, right? It's the same conversation going back to kind of what should we eat and what shouldn't we eat. When I started, you know, eating healthier, I was paleo. And so I ate a ton of nuts and seeds. Mm-hmm. That's what everything was. Everything was substituted from something real, like butter, into something completely different. And so I stepped away from, okay, maybe having raw milk to the almond milks, the oat milks, and then you're consuming more gums and all of these different things. And I always tell my clients, it's not that having like some nuts is bad. It's just how many are we actually having, you know? Right. And so I think it's kind of the same thing with the extremes of like some people obsess, and I'll post a picture of like, let's say peanut butter. I don't do much peanut butter, but regardless, right? Someone will be like, oh, you can eat peanut butter. It's like, well, I can eat whatever the heck I want. So can you. But it's these extremes of like this black and white and good and bad that are really impacting so many different things. It impacts more than we think. Truthfully.
Oh, yes, 100%. And it's hard when you're coming from a diet culture mindset to this and you're like, it's another diet. It's not a diet. So it's just, yeah, I feel that.
It's so hard.
Okay, so we'll wrap up with these final two. So we'll do, I think a lot of people are definitely interested in knowing what labs to get when they're at a doctor, because I think that's something most people struggle with. And then for those that are on thyroid meds, how can they support themselves to come off of it, and also what that process and duration, how long can that normally take?
Yes, so there are different ways to really kind of monitor your thyroid, and I can tell you my approach. Everyone's approach is going to be a little bit different. Unfortunately, most standard marker that's used in conventional medicine is TSH when you do blood work, and then the occasional T4. So will be included. And it is just does not give us enough picture. So usually what happens is you go to the doctor, you do your physical, let's say they run TSH, like your thyroid's perfect, everything's normal, but you're not feeling good. I mean, we have to talk about these symptoms, right? maybe you're rapidly losing weight, because that's a possibility, or you're gaining weight, or you're struggling with that without having to cut something extreme out. You know, losing hair is very common, feeling cold all the time, losing part of your eyebrows, kind of thinning hair in general, showing up on your skin, and your nails. That's a huge indicator that your thyroid isn't functioning properly. Brain fog, being exhausted, because our metabolism is our energy. And so if you're tired all the time, you feel like you have this brain fog, a lot of times those are these huge red flags. And unfortunately, when you go to the doctor and you express this, they're like, let me check your thyroid. I mean, I feel like I've had my thyroid checked since I was like 12 years old. And it was always normal because they only ran TSH, but I was like exhausted. So usually they're running TSH and maybe a T4 if you're lucky. For myself personally, I usually say running minimal TSH, free T3, free T4, total T3, total T4, reverse T3, and then you want to look at the thyroid antibodies. So that's from a blood marker standpoint. The next thing that I usually always do with my clients, especially in the last kind of year, 9 months or so, I always do an HTMA test for them. So that gives me a good understanding of what their mineral status is. It helps me to support them from that nutritional standpoint to see where they're lacking. You know, seeing what their calcium is, their magnesium, their potassium, their sodium, which are all huge. Get a look at their copper, also selenium, and so many other things. So HTMA, blood work, and then symptoms are huge. So really kind of understanding what your symptoms are. A lot of times blood work can be perfect even when I run, you know, a good amount of blood work. And then I can look at their HTMA and I can see that things on a cellular level are not functioning properly. And with some other clients, I will run other things to look at their iron markers, their copper and stuff like that. But, you know, if you're going to the doctor, I feel like at least getting that blood panel to look at that is ideal, and pushing for more than just TSH. Unfortunately, you do have to write it down and hand it to them, and sometimes it still doesn't get done. I've had people ask for full thyroid markers, and doctor says, yep, I'm doing it, and it comes back with 2 markers. So unfortunately, you have to really ask, and the advice I would give is if your doctor says you don't need that, then what I would say is, okay, fine, but I want you to put that in my chart that I asked for a full panel, and these are the markers that I requested, and you're telling me that I don't need that. And then, you know, they work for you, and you can find someone else if that's your choice, you know.
Yeah. Very insightful.
So, you know, and unfortunately you do have to be your advocate as much as possible. And it's hard because it's overwhelming, and we kind of clam up when we're in the doctor's office. But I'll be honest, even in a functional, holistic standpoint, I've had certain markers that I've looked back as I've learned more, and I've never been talked to from it. So I think that we need to just do better as a whole, as a society, and that's where the HTMA and the symptoms really come into play, to say, okay, something's off here, and I'm going to listen to you, and I'm going to support you, and we're going to get to the bottom of what's going on, because it is really part of that root cause of really what's going on in the body.
Right. No, I think the HTMA coupled with that is really amazing. So
it's great. Yeah. And not everyone can do that, but at least an HTMA can give me more guidance on how can I support you with food and everything else, and really kind of giving me an understanding of what your stress timeline looks like and how depleted are you, so that we can support you as best as possible. So when it comes with like someone on medication, and I know someone asked if they don't have a thyroid, like, can you live not having a thyroid? And the answer is yes. I've had clients who've actually had no thyroid. And so when we're looking when we're looking at blood work and in general, and I'm not treating, I'm never diagnosing, but I can pull up red flags to then help get answers from you from a physician. So we want to rule out any autoimmune conditions like Graves or Hashimoto's, other things that can be flagged if we have like nodules or cysts. So struggling more and more of the cancer realm of things. And then we have hyper or hypothyroid. And I have a lot of clients who come to me on medications, And truth be told, some of them come to me, they feel awful and they've been on medication. And once they start advocating and really talking to their doctor of like, I want to get off this medication, what can I do to support myself? We can support their body. We can cut back on their medication with, in combination with their physician. And their thyroid functions optimally right away. A lot of times what happens is you have people on a lot of medication for a long time and no one is actually checking in with them.
Mm.
So nothing's adjusted. Nothing is checked in. Sometimes people are on medication when Hashimoto's or Graves is more of an autoimmune condition, and it's not supporting their body overall. So yes, the answer in general is if you are on medication, the best way to really start is to know, okay, what's your baseline? What are you looking at? And then really looking at that baseline and saying, okay, what are our stress levels like? Are you eating enough? Is your blood sugar balanced? How are we supporting your body as a whole? Are you eating nutrient-rich foods? And really starting there and then kind of going down the list. I think when we talk about health, it gets very overwhelming and people feel like they have to do everything or nothing. And it needs to be more digestible. We need to be able to, start by eating breakfast. That's it. Like eat breakfast, 30 to 60 minutes. Get your eyes in the sunshine, call it a day. Okay, you're good so far. Like little things that you are going to do for a long stretch of time versus I need to take 20 supplements and I need to do all these things. I think kind of more realistic, and we have to get back to those kind of not sexy stuff, right? Like it's not the fun stuff, but it's so helpful,
Oh, 100%. Again, that's a common occurrence on every live I've had is the foundations.
And it's funny. I just had a client message me, and she has struggled with thyroid stuff for quite some time, and we were chatting, and I was explaining to her like you have to focus on the basics. Like she was like, I haven't been eating breakfast. I'm like, you have to eat breakfast. We have to do these things. And today she sent me a message, and she was like, okay, like I added in that second adrenal cocktail. Because she did one, I'm like, just let's go back to the foundations. Let's go back to this. And she's like, Jen, it's been a game changer. And I'm like, but see, it's just something so basic and you are on less supplements. You're not taking all these things. You're not as stressed. Getting those minerals that you need. Oh, did you lose me? Are we good?
Sorry.
No, you're good.
My timer came up. Okay.
No, you're good. So yeah, I think going back to the basics and supporting your body as a whole, whether you're on medication or not. And I think people have to remember, if you're on medication, you're not broken. You can change things. We can swap things. We can reverse things. We just have to be committed. And I usually say, don't DIY it yourself. Work with someone who's going to support you along the way as best as possible.
No, absolutely. I think that's the best advice. And I think people really, it is overwhelming. I'm even overwhelmed. So I think it's just important to know that we are always going back and taking things little by little. But it's crazy and awesome to know that no matter what area of the body we are supporting, the foundations support everything, holistically, like you said.
100%.
So
100%.
Well, I am so thankful for your time today to
Thank
discuss
you.
this. So to finish up, if you can just share a little bit about where people can find you, how they can support you, work with you, all of that.
Sure. So best way to kind of contact me right now while I'm kind of revamping some things is on Instagram. So Jen Merrick Wellness. There is a form under my bio, work with me if you want to set up a discovery call, but I'm pretty open in my DMs. I don't do like targeted health advice, but if you have a question, I have a ton of thyroid information on my page. And so I always say, just start with that and just start digging in and just make small changes that are attainable, like eating real food, and start from there.
Perfect. Well, I will post this in my feed for anyone that wants to watch, but I look forward to supporting you further and staying connected.
Yeah. Thanks so much.
Yeah. Have a great day, Jen. Thank you.
You too. I'll talk to you soon.
Bye.
Bye.